Thank you, Catherine. Good afternoon, everyone. It's my pleasure to introduce Dr. Wayne Koff, our speaker this afternoon, who traveled from the Research Triangle in the Raleigh-Durham area to be with us today. Wayne is the president and CEO of the Human Vaccines Project, and he'll tell you himself about the groundbreaking work they do, and I'll tell you just a little bit about Wayne. Wayne is a renowned viral immunologist with a PhD in microbiology and immunology from Baylor School of Medicine and many, many publications to his credit. He has a faculty appointment at the T.H. Chan School of Public Health at Harvard, serves on the board of Wave 80 Biosciences and on the scientific advisory board of United Neuroscience. Before joining the Human Vaccines Project in 2016, Wayne was the Chief Scientific Officer and Senior Vice President for R&D for the International AIDS Vaccine Initiative, known as IAVI. And before that, he was the VP for Vaccine Research and Development for United Biomedical. In other words, Wayne Koff has been on the leading edge of biomedical research for many years. And now he's on a mission to generate a critical partnership between two very different scientific and technical communities, a partnership that will unlock a revolution in medicine and health. Please join me in a warm welcome for Dr. Wayne Koff.
It's wonderful to be here. And I could sit here all day and listen to all the honors and wonderful people that are in this room. It's an incredible audience, but I've only got a little bit of time. So what I want to do is to really look out ahead and look where we're going to be in just about a decade. So I'm going to begin with a cartoon here, and I think that we've all been in this situation where each year, each of us has a doctor's appointment, and we walk into the doctor, and he or she, checks us out, and we get back a lot of numbers on our creatinine and bilirubin and things we don't understand at all. And so just about a year ago, I asked our doctor, "How's my own immune system doing?" And she looked at me like an alien. And she said, "We don't have anything to test." And this is the problem. Everybody's immune system is unique. It's from our parents, it's from where we live, what we've been exposed to, what we eat, et cetera, et cetera, et cetera. And it's a complex type of a system that we just haven't been able to wrap our arms around. And what we really, really want to know, and COVID has highlighted this in spades, is why do some people end up doing a lot different than others and a lot better? And so in the last 18 months, we've seen billions of individuals now exposed to a novel virus. And some of us have remained asymptomatic, and some of us have gotten a mild disease, and some of us, unfortunately, have gotten a severe disease and hospitalized and deaths. And we just passed 1 million deaths in this country. We don't understand why. And so our problem here, and it goes well beyond infectious diseases, it goes to all the cancers that inflict us, Alzheimer's disease, autoimmune diseases, etc., is that the human immune system is at the core of the blocking of all infections, prevention of all diseases, and control of all diseases. And until now, we haven't had the tools to really even begin to understand it. So about a half a dozen odd years ago, after I failed over and over again in HIV vaccine development, I finally realized, and we as a team finally realized, that we understood a lot about HIV, but we didn't understand really anything about the host. And so that was a paradigm shift in our thinking, and we launched the Human Vaccines Project, which is really attempting at the molecular level, I'm not going to get into a lot of science here, but at the molecular level, understanding how the human immune system works. And we realized early on that there is not a single institution that is going to solve this problem. It has to be a global consortium. And that's what we've begun to set up with the best of the academic labs all over the world, industries, all of the vaccine companies, et cetera, a number of the governments and NGOs, et cetera, as a partnership. And the first thing we wanted to do is ask the question, is this feasible? So we had to go ahead and we use our licensed vaccines, the hepatitis B and the influenza vaccines and others, and tested hundreds and hundreds of individuals, comprehensively analyzed them, and actually reached a conclusion that eventually it will be feasible to understand how the human immune system is working in each individual and shift the individuals in a positive direction. But Einstein has told us that if you keep on doing the same thing over and over and over again, you're never going to make it. And we reached a point about a year ago that we had an unprecedented scale of data. We couldn't understand all of the data that we had. And so again, we had to think outside the box. And as I look around the audience, I see a number of people who would have seen the old Olympics in 1968, and the high jumper who revolutionized that whole field, where he was a scrawny kid, and he tried the old-fashioned way to get over the bar, and he couldn't get over the bar in the old-fashioned way. And he realized if he turned around and leaped off his one leg and went over the bar in the opposite of the direction, he could surpass everybody else. And that transformed his field. And what that we want to do here is transform the immunology field. And so if you think about it, over the last 100 years or so, we've had a couple of innovations that have really transformed everything. The Apollo moon landing opened up our cell phones that we have now, our laptops, et cetera. It began a revolution of the computer industry. The internet came along and transformed everything we do in terms of e-commerce and opened up the windows of social media, et cetera, et cetera. In the Human Genome Project that we kind of are modeled on, transformed everything we are doing now in terms of the biomedical research. And the project, it began actually as an idea in the late 80s when a group of people posited the idea that if we could sequence our genome, our whole genome, we can open up the doors of individual medicine. And at that time, they had the tools to just begin the journey, and they had to build the tools as they moved along. And it took about a decade, and it took a couple of $2 billion. But they succeeded, and they sequenced a human genome, which is relatively small in the context of what we're talking about here. Our immunome is billions of times larger. And it's the constitution of the genes and proteins and cells in the body that are the constitution of the human immune system. So how do we go about this? What is the innovation that we have to bring to the table? And as Marianne has introduced, we're at the convergence now of AI in human immunology. And this is going to give us the opportunity of really understanding how the human immune system works and shifting the whole paradigm as we go ahead. as we've seen in a range of industries, is disparate from investment banking and climate, imaging, et cetera, AI and machine learning is revolutionizing the world. But what we're talking about here is to take a drop of blood from hundreds and hundreds of thousands of individuals across the globe and comprehensively analyze the individual's immune systems with tools that we had never had before. I'm not going to go into the details of what we're able to test, but in essence, we can test everything about the human immune system now in a single drop of blood. And so we are morphing, if you will, in the Human Vaccines Project to become the Human Immunome Project. And the goal of the project here is to create an AI model of the human immune system within a decade. And as I wrap up here, I want to talk about the next 18 months. Because in the next 18 months, we are going to run a series of important meetings in which we bring the immunologists and the AI specialists all together from academia and industry, and we map out a strategic plan for the A to B to C to D of the way we're going to get there. We don't know where exactly the journey is going to take us. We do know that we will be able to get there. At the same time, it's going to take a movement. It's going to be outside of science. We need the help from all of the industries in the business now to build a case, to build a call to action, if you will, and get us over the next hump in the next 18 months. And if we're successful, it's going to revolutionize all of human health. In the biomedical research space, it will be a Rosetta Stone, if you will, for the next generation of scientists. In the product development space, it will enable us to have in silico vaccine trials, in silico immunotherapy trials, et cetera. And lastly, it should help us all to lead healthier and longer lives and bridge the equity gap that we see so strikingly so now across the world in human health. So I'll stop there, and I'm happy to answer any questions. Thank you. Okay.
So, Wayne, I want to follow up on something you said that I didn't understand and maybe others didn't, but I'm going to preface it. You talked about in silico trials, which I didn't understand, but I want to frame this question because I've also heard you say that we, the human race, got lucky with the rapid development of the COVID vaccines because, if I got this right from what you said, the COVID molecule is particularly easy to attack. So say a little about that and then talk about how these in silico trials are different and perhaps faster.
Great question, thanks. Is this on?
You have to turn it on.
Great. You able to hear me? Yes. Great. So in fact, we got really lucky. If this virus had been like HIV, we wouldn't have had a COVID vaccine. We in the HIV field, and I began working on HIV in 1988. We've been chasing HIV for it's decade after decade, and we don't know how to neutralize HIV. But this virus, in particular, had come along, and it had like a shining light. Come and get me, and the antibodies were easily able to just latch on and neutralize the virus. The other reason we got really lucky is that as bad as the virus is, it's not as bad as MERS, it's not as bad as SARS, and we had the tools, and we were all ready to go, and so we could make a vaccine within a year. On the other question is, it really gets to how vaccine trials are done. In the COVID vaccine arena, with the Operation Warp Speed, we immunized hundreds of thousands of individuals, and we asked a single question: are we making antibody? We have the capacity now from some of the tools that I showed you on one of the slides to as easily immunize 1,000 individuals and look at 1,000 markers. Where we want to get to is to ask a machine if the vaccine is going to work. And that's what I mean by in silico trials.
And the machine presumably can answer in days what would take months or years?
In probably less than a day.
Wow.
Probably less than a day. Because you can run hundreds and hundreds and hundreds of thousands of trials a day on the machine.
So maybe you've already answered this question, but let's just say that we get lucky again, and the next pandemic doesn't strike until the immunome has in fact been mapped, so in 2032. How will that protect us better from the next pandemic?
Well, I think it's going to protect us in a variety of ways. One, it should accelerate the speed of the development of the vaccines. But I think the real home run here is that if we look around the room here now, and we took a little bit of blood from each person, we would see a bell-shaped curve. And most of us would be right in the middle. We've got a pretty good immune system. If we get a cold, we're not going to die. But there's a subset of people whose immune system is really suppressed, who need to get an extra booster or two. And there's also, on the other side of the coin, individuals that have the overheated immune systems and have one autoimmune disease or another. And so we want to try and bring everybody into the middle, and that's what we're going to have the capacity of doing. We can't really do that at the moment because the immune systems are so individualized.
Thank you. I have one more, again, related question that you may already have answered. On the website of the Human Vaccines Project, on the front page, it says, "Our scientists are decoding the human immune system to transform how we diagnose, treat, and prevent diseases for all people." Can you talk a little bit about global equity? Because, of course, we've seen a serious lack thereof in the distribution of the COVID vaccines.
Yeah, this is a really, really critical issue, and it's an issue that is close to our heart. In one of the programs that the Vaccines Project is working on is in the maternal infant health space, where each year millions of infants are still dying, unnecessarily so, because there isn't the prenatal care, and there isn't all of the benefits of maternal health that we have access to in this country. And as you mentioned, the access of the vaccines has been a disaster. Has basically been a disaster, in the sense that the wealthy and the industrialized countries have bought up all the vaccines initially. And we got our vaccines, which is wonderful here, but still there are a number of countries in Africa that only have 8% of the population immunized, et cetera. And for a pandemic, if you still have an active virus out there, and we have Omicron out there, and we're still on the upsurge here, we're going to see additional of the variants. So we have to figure out a way to get the whole world immunized.
Thank you, and I think we're going to open the floor.
We have time for a few questions. Let's see, Russ, I see you in the back there.
Wayne, it's a fascinating initiative. For this group, could you maybe expand upon the role of the immune system that you're going to be exploring for diseases beyond just infectious disease? That's critical, it's immediate, and has an immune approach to. But cancer, heart disease, Alzheimer's, how might this impact our understanding, diagnosis, and treatment of these major diseases as well?
Yeah, thanks, Russ. And I think that's where the biggest impact is going to be. If you look at cancer, just as an example, there isn't a single cancer. It's a whole range of cancers, whether it's pancreatic cancer, colon cancer, whatever. But each cancer is also individualized, and so although we have tools now, and the monoclonal antibody, the revolution in development of antibodies against one aspect of the immune system has opened up the door now to the immunotherapies of cancer. They only work in a subset of people, and they only work in a subset of cancers. And so until we understand how the immune system is working on a population basis and on an individual basis, we are still going to be in a situation where only, I think it's 15% of the individuals who are treated now with the immunotherapies are gaining the benefit. Alzheimer's is another example. If you're lucky enough to achieve the age of 85, 1 out of 3 individuals is going to get Alzheimer's or a similar neurodegenerative diseases. And our immune system acts as a sentinel, if you will, and we don't understand how it is protecting the other folks in terms of them not getting Alzheimer's, nor do we understand, why the 1 out of 3 is 1 out of 3. So I think this is going to open up doors across a range of the non-communicable diseases. We could talk about heart disease. We could talk about autoimmune diseases in a similar fashion.
Let's see, Michelle?
Yeah.
Thank you so much.
Yeah.
It's exciting to think about the vision of what's possible. What needs to happen in order for that full vision to be realized, and what might be standing in your way?
Well, I think the issue, with any new initiative, is to gain a critical mass of support, and to get over that inflection point, and that's what we're attempting to do over the next 18 months. And it's really is 3 issues. One, it's gaining the key stakeholder support from the key agencies, the research agencies, the Wellcome Trust, the Gates Foundation, et cetera. 2, it's a call to action, a global call to action, with a strategic plan, laying out a set of key milestones so we can understand exactly where we are on the path. And 3, of course, as it was in the Genome Project, it's the resource mobilization to be able to gain the kinds of resources as we move along the journey.
I have to interject quickly and say, and aren't you going to bring together these 2 disparate communities soon?
Well, in September, we're going to have a meeting of the leading immunologists of the world and the leading AI specialists. And most of the AI specialists are from industry, and most of the immunologists are from academia. And we might as well be at a WHO meeting because they speak completely different languages. We might as well have the headphones on and translate. And what we're going to attempt to do in September, at the end of September, at this meeting, is to frame our strategic plan, to have the immunologists educate the AI specialists on what are the unsolved issues in human immunology now, and to have the AI specialists say, here's what we can do now, here's what we are going to be able to do in 3 or 5 years, here's what we might be able to do in a decade. AI is changing everything, as you know, and I'll tell just one last anecdote. AlphaGo is the AI program that has beaten all of the champions of the Chinese game of Go. It did that because it was trained on 150,000 of the games of Go, and it learned all the moves, and it was able to beat the champion. 18 months later, AlphaGo 2 taught itself. It didn't have to have all of the data. It taught itself, and it beat AlphaFold 1. So unfortunately, our brains have probably reached a point of we're not going to get a lot better, but these machines exponentially are getting better, and it's the merger of the two. It's the creativity of the human brain and the firepower of the machines, which is going to get us over the hump.
Dr. Koff, thank you so much for your life-saving work, and to you and Ambassador Peters,
Well, thank you.
so much.
It's a pleasure to be here. Thank you. Thank you.
Thank you all again for being here with us, and we look forward to seeing you next week with Raphael Bostic. Have a great week.